Hello everyone, this is Dr. Swapnil Chandratri here. Today I want to share you a very good news that I have cleared all of my KP exams in a first attempt. Today I am going to share you the experience of my personal KP exams. If you haven't subscribed to this channel, please subscribe to it because such information you are not going to find anywhere. Before I share you my personal experience, let me tell you few more things. This experience video is only my personal experience, so you don't need to make it generalized. Everyone will have their own experience, but I am just sharing my experience will be differ from person to person, so you don't need to make it generalized. Second thing is that I have cleared this exam in the state of Sachsen, which is a Saxon state. Every state has most of the time the same structure for the exam. It is more or less the same. Only the fee structure and the waiting time structure, whatever the exercise which is given for the practical exams and all those things might be differ. That will depend on state to state. Most of the structure will remain the same. Third thing is this video is only my experience video, how to prepare for all these exams and all that, which requires a lot of more time and more dedicated video for it. So I will make separate 3 videos for the 3 exams. So this is just my experience video. Let's start from the beginning. So when you clear your FSP exam, after that you apply for your work permit, and that work permit will take approximately 1.5 to 2 months time. When you receive your work permit, you can start working as an assistant dentist. You will be automatically enrolled into the KP exam waiting list. This KP exam is most of the time conducted twice in a year. 2 rounds will be there. The first exam is your Schriftlicher Teil, which is a theory exam. This theory exam is the first exam you have to give, which is everywhere the same. I have made a separate video previously regarding the KP exam structure, so that structure remains the same. In this KP exam will also remain the same. I received this date for this exam 3 months before. They give me a rough date. During this time your exam will be there and you need to pay this much amount of money. I paid 395 euros for this first exam. When I paid this money, I was enrolled into the waiting list. Then 2 weeks before this exam date, I received another letter which stated your date and time, your place of exam. You can prepare accordingly that. In that theory exam, again it's a 45 minutes exam. You go there, you will be given paper and pen and all those things you will need to bring by yourself. That question paper, there was photographs of model, also intraoral photos, there was OPG and all that thing. There are questions. Most of the time the questions are what is the diagnosis of your case, what are the prognosis of all of the teeth, then what are the pre-treatments you will do, then what are the definitive treatment, the prosthetic treatment. You know, there are multiple options that you need to plan the case in such a way that there are multiple options you can give, removable prosthetic or a fixed prosthetic or implants or something like that. You need to give at least 2 of the solution for amygdala and 2 for the mandible. You need to solve this case in 45 minutes time. That is very important that you prepare accordingly. This prosthetic solution you need to give based on German insurance system. Here the rules and regulations are there. Not like that you can do anything you want. So here those are rules and regulations. According to that you need to solve this case. So in 45 minutes when you are done with your case and your exam is over, you need to submit your paper. Within 4 to 6 weeks time you will get the result. After that, if you have passed this exam, then you are eligible for the second part, which is your Viva part, Mündlicher Teil. If you are not able to clear this exam, you need to repeat this theory exam again. In my case, after 6 weeks, I received the letter which stated that I have cleared the exam. My Viva exam will be conducted on this date. I got the rough idea, so I got in between 3 months time in between the theory and Viva exam. I prepared in that way. That Viva exam was costed 1100 euros. Again, before 2 weeks time, you receive the exact time, date and the place where you need to give this exam. Also you will receive the list of examiners that who are going to be there. Most of the time there are 3 examiners. That is Viva part. In that Viva part I gone there. Generally when we go for this Viva part, they have our CV. This is very important that they know that who you are and what you have done previously. For example, in my case I am MDS periodontist and implantologist. These examiners have read my CV. They have prepared the question accordingly. First examiner started the questions with the implant. He asked me that what are the types of surface treatments on implants and what is the action of every surface in which implant system, which type of surface is there, all those kind of questions one of the examiner asked. Then the second examiner asked me the first round regarding what are the things you need to remember in terms of medically compromised patients, you know, what you should take care regarding the adrenaline content in local anesthesia, in which patients you need to take care of it and what to do, what not to do, if you give too much of LA and too much of adrenaline, then what can happen, and all those things regarding the medically compromised patients and all those stuff. The third examiner asked me more about the periodontics. Here in Germany, when you do a periodontic treatment, there are stages of periodontal treatment, stage 1, stage 2, stage 3, that you will learn later on when you are here. He asked me that what is the Stufe 2, that means the second stage of the periodontal treatment, that I explained in detail. And then he asked me about the chemical plaque control, how to apply it and what to do, what are the studies have been done regarding that, and all those things he has asked me. In the second round, it was also again more about implantology, that doctor asked me about explain the entire process, that once a patient comes in your clinic from beginning till end, what do you do step by step for the implants. So I explained everything in detail, step by step. It is very important that you visualize these things there, that how you will treat that patient in sitting by sitting. So it's not like that you just give rough idea and it will be over. No, you need to explain everything in detail. Then they asked me about the digital implantology and what are the navigation implantology and all that. My exam was more about implants and perio, because they already read it that I am implantologist, so they want to check that what level I am. They did that. I answered 80% of the questions. Once this exam was over, they told me to wait outside. In 10 minutes time, they called me again and they told me that I have passed this exam. They have told me that in which area I need to improve, what should I learn and what should I take care of about, and all those things. Then you go home. Then after 1 week time, you will receive the letter that okay, that you have passed the exam. If you have failed the exam, that the letter will be same that you have failed the exam and you need to repeat it. But if you have passed it, then they will tell you that your rough exam date for the practical part. Again, in between theory and practical, in this Viva and practical, I got 3 months of time. I prepared well for this practical exam also. Again, before 2 weeks, you get date, time, and who are the examiners in these exams will be there. So you will have the rough idea that who is going to come in my exam. In most of the state exercises which you need to do is always the same. Little bit of the changes are there. You need to ask the seniors or the students who have passed this exam, have appeared for the exam in your same state. They will tell you that what they have done, and 80 to 90% of these things will remain the same. So every state has their own list to do it. In my case, my exam was in Dresden. So Aufgabe, my exercises were, I need to prepare one vestibular, what do you say in English? It's like ceramic faced atom ceramic round. That preparation, sorry, my English is nowadays a little bit not that good compared to German. That is one thing I need to prepare. I need to prepare one called overlay. Then I need to do one MOD cavity preparation with composite, one class 3 cavity preparation in front teeth with composite. Then I need to take one impression with light body and putty, one impression for this double step, 2-step technique, what we remove all of the putty material and then flow the light body and do that. Second impression, I need to take one immediate cap, what we do that, which is provisorium cap, that I need to repair. Also do one clamor in our RPD. I need to make one C clamor, that I did it. One RCT on artificial teeth that you need to do. They have also the Viva part in the practical exam, so it was not that much tougher Viva, but they were divided into 2 parts. One is more about the periodontal part and one is more about the surgical part. In periodontal part, they asked about all the curates, and I need to identify the curates, difference between scalar curates and universal curate, Gracie curate, and all those stuff. Those are the perio instrument things, that what are the types of all of these probes, this WHO probe and periodontal probe and implant probe and all those things. You need to explain those probes in detail. Smaller, all of the perio instruments. Surgical Viva, it was more about the surgical things, some extraction. So which are the forceps you use for this situation, that situation. I had to take one suture also. They give us one model. They give us the situation. Now you need to suturing, and then I did the suture. That was pretty much it. This practical exam was total 5 hours time. I paid 1500 euros for it. In these 5 hour times, you need to finish all of these exercises. Once you are done with it, they told us that we need to call tomorrow morning for the results. It was very stressful because, I want to get it done with it, but, they asked us to wait. In within 2 hours time, I received the email which states that I have cleared the exam. I am now the appropriate Zahnarzt. I have now the permanent license. In the end, I cleared all the exams in the first attempt. What is my take on this exam? Many would like to hear that is it actually doable? I would say it is doable. I did it in first trial, so you also can do it. The important thing is to prepare rightfully, prepare smartly, take this thing very seriously. If you don't take it seriously, if you take it very lightly, then it will be difficult. The most difficult exam exam which I thought is first exam, which is your theory exam, because that will test your knowledge. Viva part and practical part, yeah, anyone can cram it and pass it. Practical time can practice it so much, you can do it. But most difficult part is the theory part, because it is unpredictable, because you need to have good knowledge. If you are working in a clinic, then you are in a front runner, because you know that how this human system works. You know that how cases are solved here. You can practice accordingly. Otherwise, you need to have a good presence of mind in this the first theory part. So it's very difficult to do a time management in this 45 minutes, because I always felt that time is always less. Everyone feels like that. You need to solve this entire case very properly. You require a good amount of knowledge. The easiest exam I feel is the practical part. It's predictable. Most of the time you know that in what kind of exercises you need to do, so that you can prepare yourself. You can prepare a protocol for in your mind. You can prepare according to time and all those things. It is compared to all of these three exams, I feel that practical exam is the easiest one. The first exam is always considered is the toughest one, because again, if when you appear for the first exam first time, that's a little bit unclear ground. Sometimes stress play a huge role. When you wait for this exam result, it is very difficult. You need to wait at least 6 to 8 weeks time before you receive the result. During that time, you don't know whether you prepare for the viva or you just wait for the exam result, because no exam is 100% right, because you don't know that whether the way you have solved the case is right or wrong. There are 10 ways you can solve a single case. If whatever you have solved, is it right or not, that is what examiner wants or not, that we don't know. That's always a stressful part. The viva part, you get the result most of the time on the spot. You know that whether you are pass or a fail. But this waiting part is a little bit difficult in the theory portion. In viva part, I would say that 100% answering questions, it is not going to be there. It is not possible. Everyone will make mistake. There will be some questions you don't know the answers. Important thing is that you answer the basics right. Again, in this viva part, I have told my experience, because I am an implantologist, so they asked me more about the implantology. I know one of the students before me who has given the exam, he is normal BDS fresher. So they asked all about the normal questions like what do you do after extraction? If there is dry socket, then what do you do? So those day-to-day stuff they asked, what do you do in case of osteoradionecrosis and something like that. They ask you accordingly to your profile. See, I got this kind of question. That doesn't mean you will get it. But if you are a PG, you can be ready for a question might come in your specialty if the examiner also has the same specialty. That is what you can expect. Again, as I said, this is just my personal experience which I faced, and it is 100% doable. You don't need to worry about it. Only thing, smart preparation, good preparation. How to prepare for it, what are the tips to prepare for it, I will make separate videos for all of these 3 exams. You don't need to worry. Hit the bell icon so you don't miss out when I make this video. Like, share and subscribe to this channel. Till then, have a nice day and keep motivated yourself.